I've said it once and I'll probably get it tattooed on me, man plans and God laughs.
Robert Frias' care team kept his failing heart working for months, waiting for this.
Just know I believe in every single one of you. And thank you for showing up for work today.
Team on three. 1, 2, 3. Team.
This gift of life from a young girl.
You're the love to my heart, from Kaylin to my life.
Willing to give up her heart in death to save a life.
Strong as a bull.
That's right, baby, yeah.
Welcome to Choices, Hope, and Science. I'm Jessica Lovell. We are joining you from the Dolph C. Simons Jr. Family Broadcast Studio. Today, we follow Robert Frias' journey to a new heart. Team is a word you will hear a lot. Alexis Del Cid reports Robert found a strong team here at the University of Kansas Health System. Now, we do want to warn you that this story does contain graphic transplant video. Alexis?
Jess, Robert is a remarkable person and patient. Who among us would have the presence of mind to lead their surgery team on a chair from the operating table moments before their heart transplant? Robert would, and he did. Over the next half hour, you will witness more remarkable moments, including this one, the moment the surgeon places the donor heart into Robert's chest. But getting here, that was quite a ride.
All right, I'm gonna listen to your heart.
All right.
I've never heard an LVAD.
Okay.
It's not often you meet someone whose heartbeat sounds like this.
Can you hear it?
It sounds like a techno.
Yeah.
That's because Robert Frias doesn't really have a heartbeat, or a pulse for that matter.
If I go like this, they don't get a pulse.
He does have a pretty good sense of humor about the LVAD device keeping him alive.
I have a battery pack here. This is my control unit. The batteries, bunged. James Buck, locked and loaded. My dad was like, you're an adult now. I'm like, I know, still, it's fun.
On this day, he takes us on a tour of Central States Medical Supply,
This is our medial pivot knee.
where he's happily back to work as a sales rep,
4-corner, tri-corner plate.
supplying hospitals with all of their orthopedic tools for surgeries.
Man, I look forward to cardiac rehab now. I look so forward to just spending time with my daughter and my son and being a part of life now.
The trouble began in 2014 when doctors at another hospital diagnosed Robert with congestive heart failure and implanted a defibrillator in his chest. After that, Robert says he thought he was fine. But a decade later, at a routine doctor's appointment in May of 2024, Robert blacked out. When he came to, he was in the hospital.
And then they came to me and said, we need to transfer you to KU. You're end-stage heart failure and you need a transplant.
But it turned out Robert was too sick for a transplant. They didn't think he'd survive it.
Being so sick as I was, they decided to go with the LVAD.
So the guy who'd happily observed thousands of orthopedic surgeries throughout his career was about to be the guy on the table undergoing open heart surgery.
I tell everybody I've not felt this good since my 20s. Honest to God.
And Robert's cardiologist, Dr. Hirik Shah, is here in studio with us today, along with his cardiac thoracic surgeon, Dr. Tyler Zorn, and Dr. Matthew Danter across from me, the surgical director of cardiac transplantation and mechanical circulatory support. Gentlemen, so glad to have you here with us today. Robert joins us virtually with us. Robert, you have been on such an amazing medical journey that we are going to share over the next half hour. But tell us, what is the one thing that stands out the most about your health post-transplant?
How I feel. I've said it before and I'll say it again. I feel like I'm in my 20s again. The amount of energy I have every day is just incredible. I mean, it is a truly, my life has been changed, honestly.
Dr. Shah, we're going to get to Robert's transplant here in just a moment. But this all started with heart failure and an LVAD, a mechanical device that is often called a bridge to transplant. How did that help him work towards that transplant?
Mr. Frias, he came in incredibly sick in our intensive care unit. All of us, took care of him. And An LVAD, left ventricular assist device, is a device that's able to be implanted into the heart by the work of our surgeons, and able to take over the function of the left side of the heart. And for patients who come in incredibly sick and don't have a lot of time, because in transplant we have to wait for the right match. We have to wait for the right, match that will work for that particular patient. For patients who might not have enough time, the LVAD is an excellent therapy that allows us to essentially normalize their cardiac function, allow their organs to get adequate blood flow, basically make the patient healthier, and then they'll be in a much better place to get a heart transplant. When you're kind of walking into your heart transplant, it's going to be a much better outcome than going in incredibly sick, kind of getting wheeled into the ICU.
Well, let's talk about time, because time is key here. And Dr. Zorn, how long can someone stay on that LVAD before then requiring the heart transplant?
Yeah, so certainly the newer generation devices that we have now are much better equipped to support people long term, with much fewer complications. And so now we see, survival, out to 5 years pretty routinely in these patients if they're not transplant candidates. Hopefully they can, if they're bridge to transplant, can be transplanted sometime before then. But
Dr. Danner, Robert had to be sick enough to qualify, of course, for the transplant, but then healthy enough to get one. What makes someone too sick to get the transplant?
Well, typically there's some features that are acute and some that might be chronic. Acutely, if they're in multi-organ failure or have, sometimes we have people that are intubated and unconscious and we don't have time to sort out all of their neurologic status or even some of their social and family supports. Those are sometimes what keeps us from moving ahead initially. In terms of what in the chronic phase are more often we encounter people who have higher higher right-sided pressures, right ventricular problems, pulmonary problems, that are issues with their diabetic control, weight loss, these kind of things. So in a more chronic manner, we try and get these people who have these relative contraindications to moving forward with transplant into a much better state, so that, like Dr. Shah said, you come in for your transplant from home and you go out with a shorter length of stay and a better hospital course. That's the goal.
Dr. Shah, then what did Robert have to do while he was waiting for this transplant?
Yeah, I think it was to reverse some of the end organ function. I mean, he came in very, very sick. He was in our ICU for a very, very long time. And his post-LVAD course initially, took some time, but he was able to recover all his organs. His kidneys fully recovered. And when he was outpatient, he was able to walk, able to do everything that he was able to do before his diagnosis of heart failure. And so I think it was him building up his muscle mass, building up his stamina, building up his endurance. And all of the reasons why he couldn't do that was probably because of his heart was just so weak. And now that he has normal blood flow with the heart pump, he was able to get the body back to being a healthier body, back to his 20s, as he says. And then he was very ready for the heart transplant.
So you sent him home to do his homework.
Exactly. Send him home to do his homework, and he did it very, very well.
He was ready. He was ready for the call. Well, we had a chance to follow Robert through his entire journey, really, including the transplant surgery. Here again is Alexis Delstead.
Jess, this is the video that makes us all smile, because Robert was very present and very chatty right up until moments before he went under for the surgery. And again, a word of warning, Robert's story does include graphic surgery video.
Lay down in bed, and then all of a sudden, the phone rings.
From his hospital bed at the University of Kansas Health System,
I'm like, no.
Robert Frias is still processing the call he got at 1 a.m. from his transplant coordinator.
So I answered, I'm like, this is Robert, and it was Clinton, and he asked me very politely, are you still ready to do this? I'm like, I absolutely am.
Sounds like a beat in a nightclub.
Yeah.
After living with his mechanical LVAD pump for 5 months, his coordinator, Clinton, told Robert that his new heart was on the way.
I remember I sat on the edge of my bed before I left. I was sitting there and going, this is really happening.
Nobody expected he'd get the transplant call so soon.
It's a little surreal right now, but it's part of it, it's part of the journey.
A journey he just updated with a social media post to his loved ones.
I can't put into words right now how much all of you mean to me. But I just need to tell you that I love you all. And that, see you in a couple days.
Hi, buddy. I love you, man. Love you guys. I'll be right back.
Right before he goes under for the surgery, Robert, always the picture of positivity,
All right, bring it in.
has something to say to the team about to give him his new heart.
Just know I believe in every single one of you. And thank you for showing up for work today.
Yeah.
Team on 3. 1, 2, 3. Team.
Robert, I've got to say, I've seen that video over and over again, and I never get tired of seeing it. Where did that come from? I mean, weren't you terrified?
I was more exhausted than I was scared. At that point, I'd been up for several hours, and you know, I actually gave that speech to my son's football team. I'd heard from another coach right before the game, and I remembered that, and that's always stuck with me. I remember telling them at halftime, and I'll tell you that we won. I don't remember, but it always seemed to rally the troops when I gave it, and that's kind of where I'm at. So,
Yeah, it was the winning chant. I like that. It was good. Of course, we know in a heart transplant, there is no living donor. Someone must be willing to give up their heart in death to save a life, and they have to make their wishes known. And when 15-year-old Kaylin Hartman from Texas died unexpectedly, her parents knew exactly what to do. In a letter, Kaylin's mother, Crystal, writes her daughter was full of life.
She started off life as a shy, quiet, and very demure kind of girl. But she came out of that with a flourish. She was an absolute card. Often I encouraged her to consider stand-up comedy, as she knew how to deliver the laugh fest so well. She was an extremely studious student who excelled in all her subjects, and she made it a personal challenge to ace any test put before her. She was putting in the hard work of self-acceptance and teaching this to her classmates. I have notes from them expressing how she taught them to love the parts of them they hated. She was sassy, full of fire. She was not a sweet and quiet little angel, but rather more like an adamant but playful wood sprite that wore a very infectious but impish grin with mischievousness in her eyes. And frankly, in getting to know Robert, my thoughts are that they matched heart to heart.
Kaylin's father, William, traveled to Kansas City to meet Robert.
Mr. Hartman, how are you?
Wonderful to meet you.
No, this is going to be a minute. Let me tell you right now, this is going to be a minute. You have no idea, sir.
I really appreciated you reaching out when you did. It was really great to hear from you, because when you go through this process, you don't know. You know they have a match, they have this and that, but you don't know if it's successful. You don't know if they made it in time to, you know, if they could use, you know. And the fact of knowing, right, that especially when it came to my daughter's heart, which was, you know, that it was successful. And what you wrote me really was a gift. And so I really thank you that that you took the time to do that, right?
William says his daughter knew how to love fiercely. He got a chance to hear her heartbeat again.
Strong as a bull.
That's right, baby, yeah.
Robert, tell us, what was it like meeting William?
It was amazing. I mean, it really was. I mean, to meet the man who made the decision to give me life, I'll be forever grateful. And it was emotional. It was a meeting that I'll never forget for the rest of my life. And I made a good friend, to be honest with you.
And your father went with you to meet William, and he gave you some advice on how to get through some of those low points. Can you tell us about that advice?
So when he was in the hospital previous to this, we'd always had this little saying to each other. And I'd always look at him right before I left, and I said, well, Dad, I said, you be strong and I'll be strong. And I never thought those words would ever come back to me until the day I was going back for my LVAD, and my dad looked at me and grabbed my hand and said, "Hey, remember what we say?" And I go, "What was that?" And he goes, "You be strong and I'll be strong." And I said, "I can, give it to me, let's go." I was ready to roll.
Good advice, good advice. Dr. Zorn, according to Kaylin's parents, she was born with a hole in her heart. Her parents also shared that she died from an allergic reaction. What do you have to take into consideration when accepting a donor heart?
Well, we look at everything with regards to the quality of the heart, the quality of the donor, what the heart looks like under certain imaging modalities that we get. And look at the size as it relates to the donor and make sure it's going to be a good fit and work for a long time, because that's what we want for not just the short term, but for people like Robert to live a long and healthy, prosperous life after they get their heart implant.
I know when you're in the OR, you're focused and you probably don't get too emotional, but what are the emotions as a surgeon to be transplanting a heart so young?
I think, there is something that still creates such awe in us all when we implant these hearts and they start up and they work like they're supposed to. But it is a little bit, just going to work and doing your job and make sure you do the right thing by each patient that you take care of. So you separate yourself a little bit, but it's still an amazing gift that's given by these donor families and donors to allow people like Robert to live a healthy life.
Dr. Shaw, what's the impact now on Robert's health with having such a young donor heart?
Yeah, it's when I think about what leads to good outcomes after a heart transplant, I think there's two factors. There's one is the recipient factor, that's Robert's factor, and then there's the donor factor. And Robert was very healthy going into that transplant. With his LVAD, he was obviously saw videos of him talking and working and all of those things, and so that played a big role in his recovery. And then, like Dr. Zorn said, we look at a lot of things in the heart to make sure it's an adequate donor and make sure the donor is going to do what it needs to do to support the recipient. And many things we look at is age of the donor, and we know that unfortunately the younger the donors, the hearts don't have the stresses that patients who are a little bit older have with diabetes, coronary artery disease, substance use and things like that. So I think it was kind of a very good match in the sense that he was very healthy. The donor heart was a very good match for him, and I think that's why we see the outcome that we see today and why he's doing so well, is that it kind of checked all the boxes.
Okay, our favorite part of the show is our community questions, so I want to get to some of those. And these are the top questions we got for heart transplant. And Dr. Dander, I want to ask you, Angie wants to know, does anything have to be done to the donor heart before transplanting it?
Well, as you're probably aware, there's a whole other team of doctors and specialists that are working at the donor site to coordinate all of the multiple organs that are typically procured. The heart itself is procured and removed in a very standard way, and then when it arrives back to the recipient hospital, it's inspected for any surgical trauma or any congenital abnormalities, which we can typically fix, most of which we would know up front, but at times there might be a small hole in the heart that we suture together, which is it's about 25% of the population has a probe patient. But other than that, we basically rely on the heart's own automaticity or its own intrinsic heartbeat to start again and to basically take over the role of the circulation once we take the clamp off.
So Jill asked, is the heart still beating when you transplant it?
No, it's typically been made inert by fluids that we give, not unlike when we put a heart to sleep for a conventional heart surgery. And then it's put in ice for the duration of the transport period. So what really starts the heart up again is when we reperfuse their own coronary arteries and when we warm up the organ. Sometimes we also have to externally pace the heart in order to give it an adequate rhythm to support the circulation. But most of the time, the heart starts up on its own. The sinking feelings as the surgeons is when the heart doesn't start up on its own, then we have to start making other decisions and other arrangements.
Dr. Zorn, when you removed Robert's heart, the LVAD was still attached, the heart was still beating. Becca wants to know, how long does a heart beat after it's removed?
I don't know. Sometimes it's beating when it comes out of the chest after you explant it. Sometimes it's not, but sometimes it can sit there for a minute or two. It's pretty wild to see a heart that's outside of the human body still beating, but it's what Dr. Danter says. These hearts, they want to keep going, and that's why when you plug them in and you restore blood flow, most of the time they'll just start up on their own.
I know you do this every day. We're just fascinated by the video and hearing your stories, so it's so interesting. Eric asked Dr. Shaw, will the heart transplant recipients always need to be on immunosuppressant drugs?
For now, the answer is yes. We do know the risk of rejection is the highest in the first 6 months to the first year of transplant. What we do is very protocolized, is that we reduce the amount of immunosuppression that we give our patients as they get further away from their transplant date. And so the side effects for immunosuppression hopefully get lessened over time. But right now, we do have immunosuppression lifelong for patients.
And David wants to know, how long does a heart transplant extend a life? And how did you have that conversation with Robert?
Yeah, when I talk to patients about, how long it's hard because we talk about medians. That means, the median average survival for a heart transplant is 12 to 14 years. But that means 50% of people live longer than 14 years. And I think that's kind of how I view it to patients. If we take care of this heart, we have a good chance to give you a decade plus of life with this heart transplant. And usually with the condition they're coming in with end-stage heart failure, that's way longer than they would be without heart transplant as an option.
Robert, I know you've been so grateful to the team here. Is there any message that you want to share with Kaylin's family and parents?
Give me a second. Thank you. Thank you so much for having the wherewithal to, at such an incredibly difficult time, to think outside the box and be a hero to numerous people, including myself. And I will forever be grateful for that decision. I will forever be, there's not a day that goes by I don't think of Kaylin or their family. That I'm truly blessed beyond words to have them, to know them, and to have this opportunity to live life. It is, to them, I love you. Bottom line, I love you guys more than you'll ever know.
And what message do you have to people about organ donation? Just about educating themselves and learning more about becoming one and talking to their families about it.
Take the awkwardness off of it. Have that conversation. Summer's coming up, families getting together. Do your homework, do your research, be a hero. Be an organ donor, save a life is really what you're doing. But make sure you express that to the wishes of your family, and that make sure it's known to everyone that you love, and that if God forbid something should happen, these are my wishes. And the old adage, we can't take it with us, but we can help another human being, which I think is innate in all of us. Be that person.
And I just noticed, Robert, the pin on your shirt that you carry with you.
I wear it all the time. I wear it every jacket, every shirt I have. It's a picture of her at the pool. Sorry, wrong one. But yeah, it's her mom's favorite, and I had a button made just so I can just look at it every day and be grateful that I'm here, and try to live the life that I'm supposed to because of her.
Dr. Danter, just a final thought. What do you want folks to know?
Well, I echo what Robert says about being an organ donor. And I also think it's hard not to be romantic about transplant. But there is the other side of that, and the tremendous gift that the families of donors and the donors themselves are able to give to people is something that I can assure you none of us take for granted. And it's absolutely certain, and it's absolutely true that the the gifts that come from that are some of the most important that we encounter.
Dr. Zorn?
I mean, it's just what an incredible journey to see what Robert has gone through, from the life he was living before to his bridge with the LVAD to a transplant that was the gift of a family that went through a terrible circumstance. But to see the outcome on the other side and to see what good Robert is doing with his transplant should be motivating to us all, and it's such a wonderful story to hear.
Dr. Shaw?
Yeah, I think they both said it very, very well. I think his journey has been incredible. I remember when I first met him in the ICU, he was incredibly, incredibly ill, and to see him now and still honor the donor's family as well as he's doing now, I think, he's a very good human being, and I mean, these stories are the reason why we come to work every day. So.
Well, Robert, we want to give you the final word here. What do you want people to know about heart transplant?
It's a life-changing event, obviously, but I would encourage people to do their research, look into it. Know this, that my life is 100% better. And I can tell you last year at this time, exactly at this time, because I went into the hospital March 15th, that I was a mess. And when I say that, I don't say it lightly. I was gaining weight, water weight by the day. It was, I was sleeping 90% of my day away. I was trying to motivate myself just to get out of a car and to walk up steps. And today, honest to God, the little things like that, walking up stairwells, walking down a hallway without stopping 3 or 4 times to grab the railing and just kind of pretend to check my phone while I catch my breath. It's the little things like that add up to the bigger things, like what's going to happen next in my life. But I can't give you this, but after you have the surgery, then you'll realize there is a better life for you. And I'm living proof of that, because I wouldn't be sitting right here, and I say this with all sincerity, without those 3 gentlemen to your right, and for everybody at KU for doing this to me. I mean, I always say this once, none of this you see here is because of me. It's because of everyone at that hospital, at the University of Kansas Hospital. That's the reason I sit here before you.
Well, we are so grateful to you for sharing your story with us here today. Robert, be well. Thank you.
Thank you. Thank you.
Well, thank you to all of our guests for being with us today. It was such an important story to share. And if you enjoyed watching Choices, Hope, and Science, I invite you to join the conversation every morning at 8 o'clock on Facebook and YouTube as we live stream patient stories like these with specialists saving lives. So join me for the morning medical update. And thank you again to all of our guests. And thank you for watching.
Coming up on the next Choices, Hope, and Science.
I have a family history of Alzheimer's. My grandmother had it, my dad had it, I have it.
Any information we can get about his disease, it will be better.
Hello, I'm Dr. Matthew Danter, Surgical Director of Cardiac Transplantation and Mechanical Circulatory Support. Worried about your risk of heart disease? Take our heart quiz for a personalized assessment and steps to help reduce your risk. Go to kansashealthsystem.com/heartquiz.